Hello. My name is Jones, and today we are going to look at the psychiatric aspect of epilepsy. Okay, so in looking at this topic, we are going to establish some of the common conditions, that of psychiatric nature that can be seen in patients with the epilepsy. Patients who have epilepsy frequently have comorbid psychiatric disorders, and research into the relationship between seizures and psychiatric disorder has begun to review a complex of relationship between neurobiology and behavior. Within this presentation, we are going to review the diagnosis and treatment of mood disorders that are associated with epilepsy. We're going to look at psychotic disorders associated with epilepsy. We are going to look at aggression, which is also seen in epilepsy. And we'll also look at the psychopharmacology of anti-epileptic drugs, which can be abbreviated as AEDs. So the psychopharmacology of anti-epileptic drugs and other psychotropic drugs or other anti-epileptic drugs that can be used. So we're going to also look at the relevant drug-drug interactions that are there in trying to help a patient with epilepsy and the psychiatric aspect of it. So to appreciate what we are talking about in the psychiatric aspect of epilepsy, let me just talk of the conditions that we are going to talk about. So we have mood disorders that can be seen in epilepsy. We have anxiety disorders that can be seen in epilepsy. Then we can also have a variety of psychotic disorders that can be seen in epilepsy. Aggression, as a mental health problem, can also be seen in epilepsy. Then we can also have personality changes or personality disorders that can be seen in epilepsy as a psychiatric aspect. Then we also have attention and impulsivity problems that can be seen as a psychiatric aspect in epilepsy. We also have anti-epileptic medication or drugs that are psychotropics or psychoactive drugs that may affect one's mental well-being and predispose them to psychiatric condition. So those are the conditions that we are going to look at, and then finally we are going to appreciate the DASH model proposed by me or proposed by Mr. Jones, as one of the models that can be used whenever we are looking at the psychiatric aspect of different conditions. It's important because we have some conditions that necessarily may not be looked at as psychiatric condition on their own, but there may be comorbid conditions, that are psychiatry of nature. Epilepsy is a medical condition, but it has a comorbid variety of conditions that are psychiatry in nature. So we may look at it as a medical condition, but it has those comorbid psychiatric conditions. So let us look at mood disorder as the psychiatric aspect of epilepsy. Mood disorders are more common in patients who have epilepsy than the general population. The lifetime prevalence of depression in general population has been estimated to be at 16.2%, that is in the National Comorbid Survey replication. And then in a different study, the prevalence of depression is looked at to be at 32.6% in people who had been told they had epilepsy. Other studies have also revealed that it even goes to about 39.7 okay, in people who have active epilepsy or have had reported episode of epilepsy. The other study that is in the United Kingdom-based population survey also found a similar prevalence of depression of about 36.5% in patients who have epilepsy. So, in looking at the psychiatric aspect of epilepsy, we are saying patients with epilepsy are more likely to develop depression, okay, as one of those mood disorders. Okay, then we can also look at anxiety disorders in terms of psychiatric aspect of epilepsy. Anxiety disorders have received less attention than mood disorders in epilepsy. Patients report fear with seizures, okay, and according to the study that was conducted, 15% report fear as part of the aura. Okay, patients who have frequent seizures actually report lower levels of anxiety about seizures than do those patients that have better controlled seizures. Okay, so perhaps because of good control of the disease and seizures, we find that those who have well-controlled seizures, they may not have heightened levels of anxiety. Okay, so it is important that we appreciate that anxiety impacts the quality of life for a patient with epilepsy when they are frequently having these seizures. Okay, so if frequently they are having these seizures, they might be anxious that even taking a certain step, it might trigger a seizure, and they may find that after some time they have hurt themselves, or they have fallen on a brazier, or something just like that. An accident has happened. So with increased levels or frequency of seizures, it may create an anxiety disorder. Okay, so this has been backed by some of the studies that have been conducted, that those with frequent seizures tend to have some anxiety problems. Then when we look at psychotic disorders as a psychiatric aspect of epilepsy, psychosis and epilepsy have a long and intertwined history. After a period in the early 20th century, when it was thought that epilepsy and psychosis could not coexist, Slater and Behead proposed that the disorder coexist more frequently than by chance. Since then, the prevalence of psychosis in epilepsy has been estimated to be as high as 9% in one study. And then the risk factor for psychosis in epilepsy also seemed to include bitemporal seizures, focus and clustering seizures. Okay, but you might find that studies may differ on this, but psychotic disorders can be seen especially for people with temporal lobe problems or seizures. Then so for those that have bitemporal lobe seizures, you may see psychotic diseases. Then the other aspects that we can relate epilepsy to psychiatry has to do with aggression. Okay, so to do with aggression, the relationship between aggression and epilepsy is a little bit complex, but not necessarily well understood. In general, two types of aggressions are seen in patients who have epilepsy. There can be some episode of aggression that is clearly linked to seizure activity, okay, and it is best understood as the periictal phenomena. So other aggression acts seem to be unrelated to the timing of the seizure and may be part of the patient's underlying character structure, caused by the socio-economic circumstances that frequently arise in epilepsy. Okay, then the other psychotic aspect of epilepsy that we need to appreciate has to do with personality changes. Given the high level of psychosocial disability and the chronicness of the disease, sometimes lifelong cause-associated disease like epilepsy may produce some personality changes in an individual that is suffering from these diseases. Okay, so physicians have been interested in questioning about personality in epilepsy since at least the we can talk of 19th century. They have been looking at this association. So people who have temporal lobe epilepsy have demonstrated personality changes, and other areas of the brain also demonstrate personality changes. So aggressive acts seem to be unrelated to the timing of the seizure, but you might find that some people may have some underlying personality changes that may be related to the seizures that they have. Okay, and then they might have changes that have been reported by the patient with temporal lobe epilepsy, okay, which affect their personality. So personality can be affected in epilepsy, especially those with temporal lobe epilepsy. Then attention and impulsivity is also a psychiatric aspect of epilepsy, in that disorders of attention, including attention deficit hyperactivity disorder, that is ADHD, have long been noted in both children and adults who have epilepsy. Okay, just citing an example, a review of the subject found in estimated prevalence of attention hyperactivity disorder among children who had epilepsy showed about 14% likelihood for one with epilepsy than those that did not have epilepsy. Children who have comorbid epilepsy most likely may develop attention hyperactivity disorder and also may have a lower intelligence quotient score. Okay, so it's important that we note that attention and impulsivity, or ADH, is one of those psychiatric aspects that is seen in epilepsy. Okay, then the other last part that we can try to relate as a psychiatric aspect of epilepsy has to do with anti-epileptic medication. The majority of patients who have epilepsy are treated with anti-epileptic drugs that control their seizures. These medications have psychotropic effects that must be considered when evaluating patients who have epilepsy. Okay, so many of the anti-epileptic drugs are used in psychiatry as mood stabilizers, but others may have effects or long-lasting effects on the patient and bring about psychiatry conditions, or bring about conditions that attract attention of psychiatry. Okay, so there are a lot of drugs that we can talk about, but the rates of psychiatric disorders in patients with epilepsy are quite high. Okay, or someone with epilepsy is likely to develop a psychiatric condition. So anti-epileptic drugs, here we are saying they are psychoactive drugs, hence considering it as a psychiatric aspect of epilepsy. Okay, so in terms of treatment of psychiatry, there can also be one of them, apart from medication, there can be issue of brain surgery, which can be done to remove or reduce sensation within the portion of the brain which seems to be overstimulated. Okay, but it is important that we note that patients with epilepsy face many challenges that may result from the illness, okay, or may result from psychiatric comorbidities that may affect them. So we can do investigation of electroencephalogram and see some brain changes that may bring about conditions that we have to consider as psychiatric aspects of epilepsy, and see how the brain is functioning. So in our first lesson, we looked at the psychiatric aspect of marijuana. Then in our second lesson, we looked at the psychiatric aspect of HIV. Now, in the third lesson, here we are looking at the psychiatric aspect of epilepsy. And our proposed model, the DASH model, reviews that when you're looking at the psychiatric aspect of epilepsy, depression can be seen. Okay, apart from depression, suicidal ideation because of personality changes can also be seen. Anxiety, especially with the frequency of seizures, we stand to see anxiety as a problem. Okay, stigma, discrimination is one of those that can be seen. And then when look at substance abuse, in epilepsy we are using psychoactive drugs to which a patient can be addicted, and they are going to use them for a long period of time, and these drugs affect patient's mood. So that is why we look at epilepsy in psychiatry, because of these aspects. Hallucination, delusions, delirium can also be seen in epilepsy. So we still strongly propose the DASH model here as some of the common conditions that are seen in a lot of conditions that have got a psychiatry aspect. Remember, in HIV, there were specific conditions that we looked at, like AIDS dementia complex, HIV dementia, HIV-associated dementia, HIV encephalopathy, mild neurocognitive disorder. There can be also a symptomatic neurocognitive disorder. But in as much as there can be all these as HIV-associated neurocognitive disorders, we are still seeing some of the conditions that we have proposed in the DASH model. We are still seeing depression, we are still seeing delirium, we are still seeing suicidal ideation, substance abuse, okay, which we say it can even come from some of the antiretroviral drugs that are a psychoactive drug and have been abused for that. Okay, so that is to do with substance abuse. And for those that are addicted, they might even use the syringes that might have the infection of HIV, hence increasing the number of people who are infected with HIV because of their addiction. So they fail to resist to use contaminated needles. Okay, so in summary, we have been looking at the psychiatric aspect of epilepsy, and we have identified mood disorders as some of the conditions that we see, and the mood disorder here is depression. Then we also see anxiety disorders as one of the psychiatric aspects of epilepsy. Then we also see psychotic disorders, okay, in epilepsy. Okay, in that patients with epilepsy are more likely to show some psychosis than people without epilepsy. So this makes it cardinal for us to look at it as the psychiatric aspect, that is psychosis. Okay, then aggression is also one of the conditions that should be considered as the psychiatric aspect of epilepsy. Of course, we have the periictal aggression that can be seen, and the other aggression that can come because of the socio-economic circumstance of the patient. Then we also see changes in the patient's personality because of epilepsy. Okay, when we talk of those people with temporal lobe epilepsy, we see some of these changes in their personality. Okay, so then we also see attention and impulsivity problems or adaptation problems in patients with psychiatry. The condition here that we have given an example is attention deficit hyperactivity disorder that we are likely to see in epilepsy. So it becomes a psychiatric aspect of epilepsy. Then the last psychiatric aspect of epilepsy that we have tried to relate has to do with anti-epileptic drugs, which are psychoactive in nature and they affect mood of the patient. So hence we are considering epilepsy within mental illness, or we are looking at it in terms of psychiatry aspect. Okay, so from me, I'm saying please appreciate the DASH model, which has proposed a lot of conditions that you can relate with epilepsy, you can relate it with HIV, you can relate it with marijuana and other conditions. Okay, so these are the only 3 conditions that we have looked at and related to the DASH model. You can look at alcoholism, you can look at institutionalism and relate to the psychiatric aspect. You can look at sexual disorders, sleep disorders, and relate it to mental illness. Substance abuse, memory disorders, you can relate all these to psychiatry and necessarily see which condition within the DASH model can help to know which conditions are likely to be seen. Okay, so from me, I'm saying please keep studying and please ensure that you listen to part 1 of this lesson, part 2, and then that is when you can necessarily understand what we have talked about in part 3, where we have looked at psychiatry aspect of epilepsy. Thank you and have a great time studying.